Jen, what do we know about these various infection patterns?
Right. Lizzie, this is changing quite quickly, and we're actually hearing from experts that the way of transmission is really changing depending on where you look at it. And the expectation is that we will potentially see more sporadic imported cases like what we potentially have seen this week in Thailand and also potentially in Argentina happening. But if we take a look specifically at what's happening in the DRC, we've seen transmission mostly be among adults through sexual contact. There's also been transmission through physical contact, but it's important to note that there are different strains that are being transmitted throughout different communities. And depending on which strain you're talking about, it affects people differently. There was concern when this first became a global health emergency last week about its effect on children. And what we know right now is that at least in Congo, about 80% of child cases is said to be this subvariant of the clade 1A, which is not expected to be deadly. But the concern, though, is really that this is spreading fast and it's changing and becoming more aggressive as we see more and more mutated strains. And so that's why experts are really honing in on the fact that we need to educate people about different behavior patterns that might need to change, but also testing to ensure that we know what exactly the strain is that is being transmitted in the different communities.
Yeah, what are the suggestions from public health officials? How concerned are they?
You know, I think it depends on where you look. They're really, you know, what we heard on Wednesday is a lot of experts talking about the education aspect of it. They did say, you know, we heard from the WHO saying that, no, this is not the new COVID. But when we talk about transmission patterns and just how aggressive these strains are, they're saying it's similar to what we have seen with Ebola and with COVID. But again, it is important to note that testing, it needs to be a part of this whole entire equation. And especially when we think about testing in Africa, because this is where a lot of the we're seeing a lot of these subvariants, and potentially then we're seeing it being exported elsewhere. But we're also seeing testing and a lot of manufacturers wanting to step up their own testing in different parts of the world, just again to understand what exactly the mutated strains are and how they're behaving differently in different patients.
And Bavarian Nordic is, of course, the maker of one of the only approved vaccines, and it reports earnings today, Jen. Did we get any guidance from them about how Mpox is going to affect their business?
Right. So what's been interesting is Bavarian Nordic is, as you mentioned, one of the only makers of the Mpox vaccine. They also have this smallpox vaccine. And ahead of the earnings that we get later today, we did hear that they expect to meet their full year target just because of a lot of what we're seeing right now. We've seen shares for Bavarian Nordic already climb more than 30% since the start of this month. And what they told us on Wednesday is that because they attained this contract with an undisclosed European company for doses, they will attain this top-year target. What will be interesting to note is what the CEO says. He'll be on the show later this morning.